when Colorado lawmakers came back into session this year, one of their big focuses was helping people reduce the high cost of care.
Denver 7 political reporter MEGHAN Lopez live at 5 to talk about their latest efforts to cut drug costs. MEGHAN?
And Shannon, earlier this month, lawmakers introduced a bill that would first study and then try to apply some of their lessons learned when it comes to prescription drug costs and create an accountability board. That bill is in its committee test right now. Now, in the meantime, there is another bill that was unveiled today that really deals with the so-called middlemen when it comes to those prescription drug costs. Getting to the bottom of prescription drug costs is confusing. We tackled that topic back in December. Basically, there's a lot of hands in the pot, meaning prices keep going up. Pharmacy benefit managers, or PBMs, are groups that operate between drug manufacturers and your insurance company to negotiate the price of prescription medications. It's also known as rebates that lower the cost of those drugs. They also help establish the list of medications your insurance company will cover. But as prescription prices continue to rise, the effectiveness of these middlemen is being questioned by more and more states, including Colorado.
There's no transparency at all. There's a lot going on with rebates that we can't see.
This is a flawed process. It allows PBMs to pocket a large portion of the negotiated savings instead of passing those savings on to the patients as intended.
So on Wednesday, a bipartisan group of lawmakers unveiled a bill to change the way the state negotiates with these PBMs. It's called a reverse auction, where PBMs would compete with one another for state insurance contracts.
So normally, when the state would put out a bid, we might only get one bid back, and we don't necessarily know if we're getting the best price.
Under the new plan, the lowest bidder wins. Maryland, New Hampshire, and New Jersey have already passed laws like this, and New Jersey claims it will save the state $2.5 billion over 5 years. Under this bill, only state employees would benefit, but if it goes well,
we hope over time, county, municipality, and private employers will also be able to take advantage of this reverse auction process.
The bill already has bipartisan support. We'll follow it through the legislative process and keep you up to date. And we reached out to an association that represents those pharmacy benefit managers, and in a statement they said, quote, "It is vitally important that the tools used by PBMs to lower prescription drug costs, such as home delivery of medications and pharmacy networks, are not restricted. When PBM tools are restricted, drug costs increase." They went on to say that PBMs are really the only ones within that drug supply chain that are fighting to lower prescription costs, and that they've saved Coloradans $16 billion over the past decade. I'm live, MEGHAN Lopez, Denver 7.
Thank you.